Robert Callahan is 68 years old and lives in a small ranch house outside of Columbus, Ohio. Last March, he went to his doctor with chest pains that had been waking him up in the middle of the night for almost 2 weeks straight. His doctor, a cardiologist he'd been seeing for over a decade, ran a cardiac stress test and submitted the results to Robert's insurance company for approval of a follow-up catheterization procedure. 3 days later, Robert got a letter in the mail. It was from his insurance company, and it said, based on a clinical review of his medical records, the catheterization procedure was not deemed medically necessary at this time. It suggested he continue monitoring his symptoms and return if they worsened. Continue monitoring, that's what the letter said, to a man whose chest was hurting every single night. Robert called his insurance company, spent 45 minutes on hold listening to elevator music, finally got a customer service representative on the line, and he asked a simple question: "Can I please speak with the doctor who reviewed my case and decided to deny this procedure?" The representative paused for a very long moment on the other end of the line. Then she told him there was no doctor. The decision was made entirely by an artificial intelligence algorithm that processed his medical records and determined his risk level didn't meet the threshold for approval. A computer program looked at Robert's chest pains, weighed them against a probability formula, and decided he didn't need the procedure his own cardiologist had recommended. No human physician ever looked at his file. Not one single person with a medical degree reviewed the case before that letter went into the mail. And folks, Robert is far from the only American this has happened to. The relationship between Americans and their doctors has always been something almost sacred in this country. You walk into your doctor's office, sit down across from someone who spent a decade learning how to keep you alive, and you trust that person completely. They went to medical school, they did their residency, they took an oath to do no harm, and that trust, that deep, personal, unquestioned trust, is woven into the fabric of how we think about being sick and getting better. Your parents trusted their doctor. Your grandparents trusted theirs. It was one of the few institutions in American life that most people never questioned, because when you're scared and hurting, the person in the white coat is the one who makes it stop. But quietly, and without any public vote or national conversation about it, that relationship is being fundamentally rewritten by artificial intelligence. Insurance companies started using AI to process claims about 5 years ago, and the technology has expanded at a pace that caught almost everyone, including many doctors, completely by surprise. Here's how it works, in the simplest possible terms. An insurance company feeds millions of past medical claims into an AI system, along with the outcomes of all those cases. The AI learns patterns, which diagnoses typically lead to which procedures, which patients with which profiles tend to need what kinds of treatments, and critically, which claims were approved versus denied in the past. Then when your claim comes in, the AI compares your case against all those millions of previous cases and spits out a recommendation in a matter of seconds: approve or deny. The whole system processes thousands of claims per hour, which saves the insurance company an enormous amount of money on the human medical reviewers they used to have on staff. And here's the part that should make every American sit up a little straighter in their chair. Nobody, not the insurance company executives, not the programmers who built the system, and certainly not your doctor, can fully explain how the AI reaches its individual decisions. It's what the technology industry calls a black box, and your health is sitting right inside of it. A major investigation published in late 2023 revealed something that should have been front-page news across the entire country. One of America's largest health insurance companies had been using an AI claim review tool with a known error rate of approximately 90% on certain categories of post-acute care denials. Let me say that again so it really lands. 90%. That means 9 out of every 10 denials the algorithm generated in those categories were potentially wrong. 9 out of 10 people who were told they couldn't have the care their doctor recommended may have been told that by a machine that was getting it wrong almost every single time. And here's the kicker. The company knew about the error rate and continued using the system anyway. Because the math worked beautifully in their favor, the vast majority of patients who receive a denial letter simply accept it and never appeal. They assume that if the insurance company said no, then the answer must be no. Less than 1% of Medicare Advantage denials get appealed. Of those that do, the denial is overturned more than 75% of the time. Think about what that tells you. Most denials are wrong, but almost nobody fights them, and the insurance company profits from every single person who gives up and walks away without the treatment their doctor said they needed. And this isn't limited to one rogue company cutting corners in some back office somewhere. Across the American healthcare system, AI is now making decisions that directly affect whether you get the treatment your doctor orders. Algorithms decide how long you can stay in the hospital after surgery. They determine whether your physical therapy gets approved or cut short. They evaluate whether your medication is worth covering or whether you should try a cheaper generic alternative first. Meanwhile, the doctor's visit itself is changing in ways most patients haven't fully noticed yet. Walk into a growing number of clinics and urgent care centers across America, and the first point of contact is no longer a nurse or a receptionist. It's a chatbot on a tablet screen asking about your symptoms and suggesting a preliminary diagnosis before any human being lays eyes on you. These AI triage systems are marketed as a way to improve efficiency and cut wait times. And sure, there's some truth to that. But what doesn't get mentioned in the brochure is that they also reduce the amount of face time you get with an actual doctor. The system handles what it considers the easy cases automatically, and doctors are reserved for the complicated ones. Sounds reasonable until you realize the AI is the one deciding which cases are easy, and it's making those decisions based on statistical probability, not on the particular way your body works or the medical history that only your longtime physician understands. Linda Chen is 71 years old and lives by herself in a quiet neighborhood in Sacramento, California. She has type 2 diabetes and has been managing it carefully with her endocrinologist for over 15 years. They had a system that worked, a specific insulin prescription, a monitoring routine, regular checkups every 3 months. Her blood sugar was stable. She felt safe. Last year, Linda's insurance company switched to a new AI-powered pharmacy benefit management system that automatically reviews every single prescription and flags cost-saving alternatives. The system looked at Linda's insulin, compared it against a cheaper brand that the algorithm determined was clinically equivalent, and switched her medication without a single phone call to her endocrinologist. Linda found out about the change when she went to pick up her usual prescription at the pharmacy, and the pharmacist handed her a different box. She called her doctor's office, but by the time they looked into it, the switch had already gone through the system. Her doctor was not consulted, not informed, and not given a chance to object before it happened. Within 3 weeks on the new insulin, Linda's blood sugar levels became dangerously unstable. She ended up in the emergency room twice in a single month, with readings that her doctor called genuinely frightening. One night she woke up drenched in sweat, blood sugar so low she could barely see straight enough to reach for her phone. Her endocrinologist was furious. He wrote an urgent letter demanding the insurance company switch Linda back to her original medication. The AI system denied the request. He wrote again, with additional clinical documentation, denied a second time. It took 7 weeks and 3 separate appeals before a human reviewer finally overrode the algorithm and restored her original prescription. 7 weeks, almost 2 months of living in constant fear that her blood sugar would crash in the middle of the night and she wouldn't wake up the next morning. All because a machine decided it knew better than a doctor who had been managing her diabetes for 15 years. Linda told me something that captures exactly what's wrong with this whole situation. She said her doctor knows her body, her history, and her reactions to medication over a decade and a half of careful work. The algorithm? It knew nothing about her except a list of numbers on a screen, and somehow the algorithm's opinion overruled her doctor's professional judgment. Now let's talk about the program that affects nearly every American over 65. Medicare, the federal insurance system that provides health coverage to more than 65 million seniors, is increasingly relying on artificial intelligence to manage its daily operations, and the implications are staggering. Medicare Advantage plans, the privately run alternative to traditional Medicare, now cover more than half of all Medicare beneficiaries in this country. These private plans have been at the absolute forefront of AI adoption, using algorithms to determine how much care each patient should receive and for how long. Multiple congressional investigations found that some Medicare Advantage plans were using AI to systematically cut off home health services for patients recovering from strokes and hip replacements. Not because the patients had actually recovered, because the algorithm predicted they should be better by a certain date on the calendar. Imagine that for a second. You've had a stroke. You're struggling to walk again. A physical therapist comes to your house 3 times a week to help you regain your strength. And then one day, the visits just stop. Not because your therapist thinks you're ready, not because your doctor signed off, because a computer somewhere decided that statistically you should be better by now. And there's a staffing crisis happening in hospitals across America that nobody is connecting to AI. Hospitals are cutting nursing positions, replacing some functions with AI-powered patient monitoring systems. The machines track vital signs continuously, and that sounds great on paper, but they cannot hold your hand at 3 in the morning when you're terrified about a surgery scheduled for dawn. A nurse at a large hospital system in Texas told me her floor went from 12 nurses per shift to 8 after the hospital installed AI vitals monitoring. She said the machines catch the numbers, but they don't catch the fear in a patient's voice when something feels different and they don't know how to explain it. And here's something most people don't realize about their medical data in this new world. When AI systems process your health records, that data doesn't stay quietly in your doctor's filing cabinet anymore. It gets fed into massive databases that insurance companies, pharmaceutical firms, and data brokers access through agreements buried in privacy policies nobody actually reads. Your prescription history, your diagnostic results, your genetic screenings, your mental health records, all of it being processed by AI systems designed to find patterns and make predictions. And those predictions aren't just being used to treat you better, they're being used to price you, to categorize you, and in some cases, to decide whether insuring you is profitable enough to bother with at all. Dr. James Whitfield practiced internal medicine in rural Kentucky for 34 years before he retired last year, earlier than he'd ever planned. I asked him why he walked away from the career he loved, and his answer was as simple as it was devastating. He said the computer now tells him how to practice medicine instead of the other way around. He would examine a patient with his own hands, make a diagnosis based on 3 decades of clinical experience, and then spend 30 minutes on the phone arguing with an algorithm about whether the treatment should be approved. He said the AI routinely denied things that any competent physician would recognize as medically necessary in about 15 seconds flat. The case that finally broke him involved an 82-year-old woman named Dorothy, who had severe arthritis in both knees. She could barely make it from her bedroom to her kitchen without stopping twice to rest. Her orthopedic surgeon recommended a knee replacement. The insurance company's AI denied the surgery because the algorithm determined that her age made the procedure statistically less likely to produce optimal outcomes, not her individual bone density, not her cardiovascular fitness, not her quality of life, just a number. The machine looked at 82 and sorted her into a box that said no. Dr. Whitfield told me that in 34 years of practicing medicine, he had never felt more helpless than the afternoon he sat across from Dorothy and told her that a machine decided she was too old for the surgery that could have given her 5 more years of walking without pain. Dorothy cried in his office that day, and then she went home and learned to live with the pain, because fighting the algorithm felt like screaming into a void that doesn't have ears. Dr. Whitfield appealed the decision twice and lost both times. He retired 4 months later. He told me the day he cleaned out his office was the loneliest day of his entire life because he realized the profession he'd devoted everything to had become something he no longer recognized. The healthcare AI market in the United States is projected to reach over $180 billion by 2030. And every single dollar of that investment is pouring in for one very specific reason. Artificial intelligence saves insurance companies and hospital systems an enormous amount of money. And in American healthcare, money wins every argument in the room. Within the next 3 years, industry analysts expect AI to handle over 70% of all routine insurance claim decisions without any human review whatsoever. Let that sink in for a second. The majority of your interactions with the healthcare system will be filtered through an algorithm before a human being ever sees your name on a screen. AI diagnostic tools are already deployed in emergency rooms across the country. They were sold as a way to help physicians identify conditions faster, but the word help is quietly becoming replaced as hospital administrators realize they can staff fewer doctors per shift when the AI handles initial screening. AI therapy chatbots are being rolled out nationwide as a budget alternative to licensed human therapists. Insurance companies love them because a chatbot costs a fraction of what an actual therapist charges per session. But asking a 65-year-old veteran struggling with depression to pour his heart out to a text box on a screen is not healthcare, it's cost-cutting dressed up in a lab coat. Studies in major medical journals have shown that AI diagnostic algorithms consistently perform worse on older patients, women, and minorities, because the training data didn't adequately represent those populations. One widely used AI skin cancer screening tool was 40% less accurate for patients over 70 than for patients under 50. The algorithm literally got worse at its job the older you were, and nobody caught the problem for over a year after deployment. We are heading toward a two-tier healthcare system in this country. One tier for wealthy patients who can pay out of pocket to see actual human doctors who spend real time with them, and a second tier for everyone else, an AI chatbot for your first consultation, an algorithmic diagnosis, and an automated claims process that is engineered to say no first and ask questions later. The most disturbing part of this whole trajectory is how quietly it's all happening. There was no national debate, there was no vote. These decisions were made in corporate boardrooms by executives who will never sit in a waiting room wondering whether their coverage got approved. Right now, only a handful of states have passed laws requiring insurance companies to disclose when AI is involved in claim decisions. In most of this country, you have no legal right to know whether a human or a machine reviewed your case. You can't appeal to an algorithm's conscience because it doesn't have one. And here's the question nobody in the healthcare industry wants to answer. When an AI makes a catastrophically bad call and a patient dies because they were denied a necessary procedure, who exactly is responsible? The insurance company says the algorithm made the decision. The tech company that built the algorithm says it was just a tool. And somewhere in the empty space between those two answers, a real human being lost their life. Robert Callahan eventually got his cardiac catheterization approved. It took 3 separate appeals over the course of 6 agonizing weeks, but he got it. The procedure revealed a significant blockage in his left anterior descending artery, the one cardiologists call the widowmaker. Because a heart attack from that particular blockage is so often fatal. If Robert had been the kind of person who accepted that first denial letter and didn't push back, he might have had a massive heart attack before anyone caught the problem, and the AI that reviewed his case and decided he was fine would never have known the difference, because algorithms don't attend funerals. Robert is doing well now. 2 stents in that artery, takes his medications every morning, walks 2 miles before breakfast, and he tells me he's grateful every single day for the doctor who refused to take no for an answer. But he thinks constantly about the thousands of other Americans who got the same denial letter he did, people who didn't have a cardiologist willing to fight the system 3 times in a row, people who trusted the process because they grew up in a country where you could trust the process, people who took no for an answer because they didn't know they had the right to say no back. How many of those people are still waiting right now for treatment they desperately need? And how many of them already ran out of time while a machine was quietly running the numbers. If this story matters to you, share it with someone in your family tonight, talk about it at the dinner table this weekend, bring it up at your next doctor's appointment, and ask them directly, has AI changed how my care gets approved? And call your insurance company with one simple question that you have every right to ask. Is a human being reviewing my claims, or is it a machine? You deserve to know. Don't let anyone tell you otherwise.